So you can really see the gap that would be left by this tumor if it were resected. So it's eaten away at the muscle, or at least grown into it. A CT of a leg with the femur, and then a sarcoma that's growing in the muscle, the soft tissue. Okay, so we have a CT scan of the right leg, and there's a sarcoma, a soft tissue sarcoma here that we're going to be making a model of. So let me just make a little indication. So the sarcoma is right there. You can kind of see it show up in the CT. So first thing that we'll do is we'll change the window and level so that we can get a better visual distinction of the sarcoma with the surrounding soft tissue. So you can kind of see it better there. And then what I'll do is I'll make a new model. Call it sarcoma. Tumor. Okay, so I'll just show the 2D representation of the model for now. And the first thing that I'm going to do is try and find a threshold that shows it kind of distinct from the surrounding tissue. So it's difficult because this image is noisy. And so what I'm going to do is turn on the reduce noise checkbox. And then as I draw, we should be able to see if it picked up enough of the underlying threshold. I think what I'll do is I'll be a bit more inclusive here and see if that made a difference. Yeah, it did. So that finds the edges fairly well here, just because I've turned on reduce noise in the model creation step. And with the basic structure of, let's delete this markup here. Okay, with the basic structure there, what I can start doing, here I'll show it to you in 3D. I can start filling in some of those gaps that are there in the middle. And I'm going to do that with the grow tool, and I'll do it as I'm looking at the image here. So this is happening in 3D, even though I'm only showing a 2D representation of it. And I'm just filling in these regions. Let's turn off the threshold so we can get a better sense of what we're doing here. In fact, I'm going to turn down the 2D fill alpha so we can really see the edges of the underlying image. Fill in a bit more here. Missing stuff there. Okay, so we almost got a pretty solid tumor now. And if we look at it in 3D, the noise, actually let's just grow a bit here to fill in this. There we go. Okay, so the noise has created these little bits that we don't want. That's because the image itself was noisy. I'm just going to turn off the 3D view when we move the image there. So if I use the smooth tool, we can actually just get rid of those quickly. It may be that that's anatomical, but for now, we'll just assume that this is basically what we want. So we have a pretty good model of the sarcoma here. Let's give it a bit more of a drastic color here, given that it's a tumor. Okay, so now for some context, I think I'll make a model of the underlying bone. So let's make a new model here. Let's call this other. And then the structure here we'll call bone. So this one will be very easy because the bone will be very clearly distinct from the rest of the image. In fact, I'll even turn off reduce noise because I don't think that we'll need it. Okay. So I'm holding the pen down on the surface as I'm moving the image in and out with the controller. And then I guess we'll go right up to the pelvis here. Turn that on into 3D to show what we've done, or what we did rather. Yeah, I guess we can just, for time, we'll just stop up here. Don't need that much of the femur, and we can stop down there. Okay, so we have a pretty good femur there. Nice and quick. Now let's do some surrounding muscle. And so we'll want a new threshold that includes the muscle here. Let's use reduced noise for this. And see, yep, that does quite a good job. We don't really care about the fine details of the different muscle fibers because we're just doing it to give some context to the tumor. So this is about as high as I'll go. Looks like I missed some spots here. I can just fill it in. Get rid of this extra stuff that I didn't mean to include. Looks like we also grabbed a blood vessel here. So what I'll do is I'll just erase that quickly in 3D. Okay, add in this bit there. Subtract out this guy. And then just to make it look a bit better, we'll do a denoise on this to pull out the average structure, basically. I think we might have missed some stuff right around the sarcoma, actually. So let's just make sure that we've included all that. Yeah, we had. Okay, so now if I make this muscle transparent, we'll be able to see how the sarcoma fits inside of it. And what I'll do is I'll subtract. So starting from the muscle, I'm going to subtract the sarcoma and then overwrite the muscle. So now, if I make the... Actually, no, let's look at it with a clip plane. So we can kind of see the gap that the sarcoma would leave in the muscle. If we go to the grab tool, let's just unlock the sarcoma model. We can pull it out. And so you can really see the gap that would be left by this tumor if it were resected. So it's eaten away at the muscle, or at least grown into it. Why don't we put it back? There we go. Delete that plane. Right, so there we have it. A CT of a leg with the femur and then a sarcoma that's growing in the muscle, the soft tissue.